My particular bias always has been that you have to spend an unwarranted in the medical healthcare system amount of time paying attention to that individual's symptoms and signs on examination. You don't get paid for doing that in the reimbursement scheme. And so I was famous in my healthcare jobs before the military job for making half of a salary because I insisted on spending twice as much time with a given individual. But I would often be able to make a diagnosis that hadn't been made before and aim that individual in a treatment plan that wouldn't have been created otherwise. And so, you know, I'm certainly not the only one that ever did that in life, but the idea is if you get into the healthcare system that requires lots of patients to go through just to make a living, you never have the opportunity to delve in great detail in any given individual's case. And I just refuse to accept that. My family suffered as a result of my not buying into that whole model, but they understood that the idea was to do it right. That was the whole basis of that approach. And I think that applied to this setting, NICO and the Markets Institute and others. It's certainly not just those. We're actually seeing the benefit of that approach. It does require a lot of philanthropic support to make it happen. Right now, the pressures are actually, unfortunately, very similar in the VA to see lots of patients and to see them quickly so that there aren't waiting lists that are thought to be pressure points and an embarrassment, if you will, to the VA. It's really unfortunate because I think there is, in that kind of a setting, an opportunity for true excellence to evolve with the level of expertise and the patient population that they have, but they're under a different kind of pressure.
This video was produced by BrainLine thanks to generous support from the Infinite Hero Foundation.